Hi, my name is Mary Beth. I am a former student of West Fork. I went to school there just like you guys, and I graduated in 2016. Now I'm a dental hygienist, so that means that I'm the person at the dental office that does all the cleaning of the teeth. The dentist comes in and checks to make sure there's no cavities, but I'm the one that brushes all the plaque and germs off. So I wanted to talk to you today about why it's so important to keep your mouth clean and some of the ways that you can do that. So the first thing is why it's important. There are two main reasons. One, your oral health or your mouth health is connected to everything else in your body. So if your mouth isn't healthy or if you have infections in your mouth, that can pass on to the rest of your body and make you really sick. Also, the second reason is because you need your teeth for eating. Of course, we all know that. And if your teeth get cavities, they start to hurt, or if you get gum disease, your teeth fall out. And a lot of people have those issues, and when they get older, they're not able to eat, and their teeth hurt, and it's not a good situation. You don't want that to happen to you, so brush your teeth. Some of the ways that you can make sure that you keep your teeth really clean is by having good brushing habits. Most of you know that you're supposed to brush your teeth. Do you know how many times a day? Or how long? 2 is the answer to both of those questions. You want to brush your teeth 2 times a day for 2 minutes each time. So a lot of people, whenever they're brushing their teeth, and adults too, they think they're brushing for 2 minutes, and they're brushing for 30 seconds. 30 seconds is not long enough. You have 28 teeth at least normally. 30 seconds, that's like 1 second a tooth, and it's not enough time to get it clean. So you really want to make sure that you're doing a full 2 minutes. So I wanted to also talk about different kinds of toothpaste and different kinds of floss. I've had a lot of people ask me what's the best toothpaste or what's the best floss. The truth is, it doesn't matter. Whatever type you'll actually use and it won't just sit there in the drawer is the best type. So if you like Crest toothpaste or you like Colgate toothpaste, use it. I would be careful with making homemade toothpaste. Some people do that and it's not always very good for you. But if you buy it from the store, especially if it says ADA accepted on it, ADA accepted, then you know that it's a safe toothpaste. And it really doesn't matter what kind you use. Same goes for floss. It's also important where you brush your teeth. So sometimes people think that they just need to brush the outside or the part you see, and that's not true. You need to brush every side of your teeth. So there's the outside here, and then the inside or the tongue side, and then the chewing surface or the biting surface, which is right there. So you want to make sure that you brush the outside, the inside, and the chewing surface because you can get the sticky plaque stuff on all of those. So is the most sensitive part of your mouth? Well, fun fact, your mouth is the most sensitive part of your body altogether. So it's a lot more sensitive than your fingers, or if you were to pinch yourself on your arm, you're not going to feel it as much as if you pinch yourself on your tongue or something. And maybe you've had a sore in your mouth and it just really bothers you. It's really sensitive. It's because you've got so many nerves in your mouth. Where the most sensitive spot is actually your lips. Most sensitive spot of your whole body. I also had another question about how do you whiten your teeth? A lot of people think that whitening toothpaste whitens your teeth, and it really doesn't. There might be some bleach in it, but it doesn't stay on your teeth long enough to really bleach it. And bleach is the only way that you can whiten your teeth. Now, if your teeth have some stain on them, sometimes you can brush away that type of stain. If it's sticky, you can brush it away and your teeth will be a little whiter afterwards. Or if you've got brown stain or black stain that's hard, you can come in and get a tooth cleaning from a hygienist, and that'll make them a little whiter, but to really whiten them from the inside out, you have to bleach them. And you can buy bleach at Walmart or at any store. A lot of times they have whitened strips that you put on your teeth, or trays, or you can go into the dental office and they can whiten your teeth. They a lot of times set you down and put the bleach on your teeth and then put a light on it, and the light makes it kind of whiten faster, and that bleach that they use is a lot stronger than anything you can buy to take home. But for the most part, if you want whiter teeth, the best thing you can do is, of course, keep them clean so that they don't stain more and get darker. But other than that, to get them whiter, actually, you have to bleach them. And just using whitening toothpaste doesn't really do that for you. So you would want to buy like the whitening strips or something like that in the whitening section at the store. We also recommend going to the dentist. For most people, it's kind of different. Sometimes we tell people to come more often, but for most people, especially kids your age, it's good to go just twice a year. So once every 6 months. And that goes with our rule of 2. You brush 2 times a day for 2 minutes, and you go to the dentist twice a year. So it's pretty easy to remember all that. Does anybody know what causes cavities? Some people might say sugar. It's really not just sugar though, because we know there's sugar in soda and brownies and candy, and all of that does cause cavities, but there's also stuff in bread and crackers and things like that that cause cavities. It's kind of in most of the food. You might have heard of carbs before, maybe you haven't, but carbs are in a lot of our foods, and carbs turn to acid. So sugar is a type of one, and it turns to acid. Or if you drink sugar-free soda, soda's pretty acidic already, so it's got acid in it. And that's really what causes the cavities, is that the acid just eats away your teeth. And a cavity is basically just a dark spot on your tooth that turns into a hole. So you have a little groove, and it gets some acid in it, and then it makes the groove deeper and deeper, and then you've got a hole in your tooth, and your tooth starts to hurt. And that's what a cavity is. So you can't avoid completely foods that cause cavities. You could, but then you would maybe only be eating vegetables, because even fruits can cause cavities. What's going to be more important is how you eat your food. So every time you eat something that can cause cavities, that has acidity to it, can have the acid in it, whether that's sugar or carb or just acid in general. Lemons already are acidic. Every time you take a sip of something, a drink of something, or you eat something, your mouth stays acidic for 30 minutes. So if I had just one little can of Coke and I took one sip every 30 minutes, then my mouth would be acidic for however long it took. So if I took 6 drinks of it, but I waited 30 minutes in between, that's 3 hours that my mouth is acidic. But if you drink it all at once, then that's just 30 minutes. So what you're really watching for is how often you're exposing your teeth to things that can cause cavities. So the best thing you can do is not snack throughout the day and not drink Coke throughout the day, but eat all your food like at your meal. And if you do snack, then drink water afterward and rinse it down. Try to drink your soda all in one sitting, and then drinking the water afterward. I want to show you the different kinds of toothbrushes. So this is a regular toothbrush, and this is an electric toothbrush. There are tons of different types of each, but for the most part, they're all the same. All the electric toothbrushes are pretty similar, and all the regular ones or manual ones are pretty similar. So there's a big difference in these, because this one does all the work for you. In this one, you have to do the work yourself. So if you're going to use a regular toothbrush, then that means you have to do like the scrubbing motion. Circles are the best way to do it, but sometimes people prefer to scrub like this. And that's okay if you want to do that. Just make sure you're not pushing too hard, because if you push too hard, it doesn't clean your teeth and it can scrub your gums away. And once your gums are scrubbed away, you can't get them back. So I always tell people just to be really gentle. Use a soft toothbrush, not a hard toothbrush. Soft or extra soft is the best thing you can do. The electric one does all the work for you. So you can see the top goes back and forth, and there's, like I said, a bunch of different types. They're not all circular, but they all move on their own. So if you have an electric toothbrush, you don't need to scrub. You just hold it on the tooth and move really slowly, a few seconds on each tooth. And these always work better than these. What you can do with this in 2 minutes would take you an hour and a half with this one. And so I definitely would always recommend having the electric toothbrush over the regular one. But you can still do a really good job with the regular one. Just when you're done brushing, look at your teeth and look to see if you can see any of that white sticky plaque. And if you do, then brush a little longer. The most important thing though with both of these is of course that you brush all the sides of your teeth, and you make sure that you get all the way to the back, to those very, very back teeth. And then the big thing that a lot of people don't do is you want the toothbrush halfway on the gums and halfway on the teeth. Because if you put it halfway on the gums and halfway on the teeth, then it brushes the tooth and the gums at the same time. And that is so important to be able to get all of the bacteria. Also have a few quick facts, and then I'll be done. So first one, a lot of people don't think about this. If you have your toothbrush out on the counter in the bathroom, and then you flush the toilet, all these germs go into the air and it lands on your toothbrush. So it's always better to keep your toothbrush in a drawer or with a cover on it. That way you don't get toilet germs all over your toothbrush. Another thing is that you're supposed to replace your toothbrush every 3 months. I really have trouble remembering that. You would think that I wouldn't because I'm a dental hygienist and in the dental office all the time, but I do have trouble remembering that because I don't remember if I bought this 2 months ago or 1 month ago. So how do you remember? You change it with every season. So in the winter I get a new toothbrush, in the summer I get a new toothbrush, when it turns to spring or fall I get a new toothbrush, and then that's for a year, and that's every 3 months. So that's a really good trick for remembering when to change your toothbrush. Another thing, this is a myth. People think that if your gums are bleeding, you're brushing your teeth too hard, and that's not true. If your gums are bleeding, it means they're infected because they're not clean enough. So the best thing you can do if your gums are bleeding is brush them more. Not brush them harder, but brush them more. Really make sure, like we talked about, that the toothbrush is halfway on the gums and halfway on the tooth. And then as they start to get cleaner and you clear out that infection, they'll stop bleeding. And bleeding gums is just a nicer way of saying gingivitis. If your gums are bleeding, that means you have gingivitis, which is infection of the gums. We don't want that. You don't want an infection in your gums because then that infection can be passed on to other parts of your bodies, remember, and make you sick. So if your gums are bleeding, don't freak out. You can fix it. Just brush your gums really good and the bleeding will go away. A lot of times when people start flossing, they bleed a lot at first, and that's totally normal. But if you floss every day for 2 weeks, really good, normally the bleeding will stop, and you get that infection all cleared up. The last thing is that most people think that they're brushing for 2 minutes, and they're really not. Most adults only brush for 30 seconds, and a lot of people say that they don't have time to brush their teeth twice a day. So let's think about how long it takes. 2 minutes. Think about what else takes you 2 minutes. Like, how long does it take you to eat? I don't eat in 2 minutes. It takes me a lot longer than that to eat. It takes me more than 2 minutes to drive to work or to drive. When I went to school, I lived really close to the school, and it still took me more than 2 minutes. 2 minutes really isn't that long. So if you have time to sit on your phone, or you have time to talk to somebody about how your day went at school, then you have time to brush your teeth. So sometimes people think they don't have time, and really, they just don't want to do it. So now that you know why it's so important, try to make time to brush morning and night at least, and floss one of those times. Sometimes it's hard to get in the habit of brushing every morning and every night and flossing at least once a day. But you just keep doing it, and once it becomes a habit, it'll be super easy. So if you guys have any more questions about teeth, make sure to let, I think it's Coach Kirk or Miss Presley know. Let them know, and they'll pass them on to me, and I can get back to you with answers. I hope you guys have a good day and brush your teeth.